practice, many parents come and ask me, ma'am, my child is still not speaking, he is still not responding, so what can be the cause? So today we are going to learn about it. Why the speech delay happens. First, we have to learn what is a normal speech. So children learn through the interaction and through socialization. So a child at 1 year of age should start speaking at least one word meaningful. They start babbling by 6 to 8 months, and they start speaking 1 to 2 words by 1 to 1.5 years. By 2 year, a child should speak two-word phrases like "give me," "take it," "mama de do," "pani do," like that. And if a child at 2 years is not able to speak a single meaningful word, then that is definitely a red flag. Or if the child comes to me and the parents say that the child is not speaking, then we have to see whether the child is interacting, whether the receptive language is present or not, whether he is responding, like if you call him, whether he is looking at you, whether he is responding to your name call, when you play with him, whether he is involving others in his play activities, he's showing interest to play with others, he's playing simple games like peekaboo, hide and seek, those kind of games, whether he is able to follow a simple instruction like pani de do, door band kar do, give me this, give this to mama, give this to papa, like that. So at least that much the child should be able to do by 1.5 to 2 years. If the child is having using gestures like pointing, showing yes and no by nodding, and he is taking you along and pointing, giving bye bye, using giving flying kiss, all these things, then at least we can say the child is having receptive language and non-verbal communication. If the child is not doing non-verbal communication also, he is not waving bye bye, he is not showing any interest when you play with him, he is mostly playing alone, he is not imitating anyone, then these are some red flag signs. How do we stimulate the child? uh, First, interaction is very important. The first 2 years are very important for child's development, especially speech and social development. So, there should not be any screen time below 2 years of age. And after 2 years, there could be a minimum 30 minutes of screen time, but that screen time should also be a not should be a passive screen time. It should be somebody should be present there. Also, what could we do if the child is not speaking, it's 1.5 year and still not speaking, you can be having more interactive games with him, like play peekaboo, play get set go. Let the child give a pause and allow the child to speak. So, and use lot of words with him. So even if you are talking to the child, even if you are bathing the child, even if you are playing with the child, always use lot of words like a commentary. See, what is this? This is a ball, we are playing ball, ball is red color, let's throw it. So what? One, two, throw. One, two, catch. So all these things, so that the child learns to use words. And what do you want? Do you want water? Okay, now we are drinking water, like that. So you have to use lot of words so that the child learns those words while playing. And have a joint attention, like the joint attention development is very important, and imitation is very important. So whenever you are doing some things, try to tell the child to pause and give him the chance to repeat what you are doing, and see whether he is giving you eye contact, whether he is looking at you while you are doing that. All these are very important points. Plus, suppose the child is about 2 years and there is no receptive language also, the child is not responding to his name, the child is not looking at you while playing, is not interacting with anyone, then these are some red flags. You should definitely have an evaluation done by a developmental pediatrician, so that you can get a proper diagnosis, or whatever going on with the child, and whether the child needs any stimulation therapies. And early intervention is very very important. So earlier we recognize this problem and earlier we start interventions, the better and faster are the result. So my suggestion would be that you have to be very very interactive. There should not be any screen time, and early you find any doubts that the child is not developing as per his pace, please consult the specialist so that you can have better understanding and the early intervention can be started faster and on time.